Because some of the earliest trials were for treatments that turned out to be symptomatic treatments, we have momentum in the study design in that direction. So we're looking for big effects, short-term effects in a moderate population. That's the history. But when we're now looking at disease-modifying treatments, we need to look at them differently and think about them differently, where a smaller effect seems like it's not as good. It actually can end up being much better because we're actually altering the disease itself rather than just treating the symptoms. So we believe that people need to start interpreting the trials differently and understanding it differently. When aducanumab and lecanemab and donanemab have posted results recently, some people have the tendency to try to and interpret them as if they were cholinesterase inhibitors, which is the wrong way to look at it. There's much more hope associated with what's going on these days, even though the effects may seem smaller at first. There's certain things that you will want to do. For instance, you do need to have maybe either more accurate outcome measures. So by combining outcomes together into a single composite, or interpreting using this time component and combining across different outcomes that way will help you get a more precise measurement. And so by not abandoning, but moving beyond the interpretation of we need to have a clinical meaningful effect in this certain very specific outcome in order to move forward, we actually need to look at all of the evidence together and that the precision that's available through that will help us to understand what's really going on and interpret it better.